So, continuing in our discussion of neurosurgeon Dr. Michael Egnor's book, The Immortal Mind, we are exploring the work of Wilder Penfield, the father of modern neurosurgery, whose mapping of the brain inadvertently provided a roadmap to the soul. Penfield performed surgery on awake patients using an electrical probe to stimulate different areas of the exposed brain. He found that he could trigger almost anything physical. By touching a specific spot, he could make a patient's arm move, cause them to see a flash of light, or even force a vivid memory to surface. He proved the brain is an electrical organ that manages movement, sensation, and memory. However, Penfield discovered a fascinating limit. He could never stimulate the mind. No matter where he probed, he could not cause a patient to reason, to believe, or to make a free choice. Furthermore, Egnor notes that in the history of epilepsy, there are no, quote, intellectual seizures. Seizures can force a person to move their limbs, smell burnt toast, or to feel intense fear. But a seizure never forces a person to uncontrollably do algebra, ponder philosophy, or judge a moral dilemma. If the mind were just the brain, random electrical storms, such as seizures, should trigger abstract thoughts, just as often as they trigger muscle spasms. The fact that they don't suggests that abstract thought, the intellect and will, does not originate in the electrical firing of neurons. Penfield concluded that the mind stands above the brain, observing and directing it, much like a user sits outside of a computer. The brain can be hacked, but the intellect cannot.